This video is for educational purposes only, and if you are experiencing any of the symptoms that are discussed in this video, please contact a healthcare provider immediately. Hey guys, today we're going to be talking about major depressive disorder and what we can do to identify it and what we can do to provide aid to ourselves or patients that we will be working with in the future. So a good starting point is really defining major depressive disorder. And in order to do that, we're going to go to the DSM-5 and particularly looking at the DSM-5 criteria. Now the DSM-5, if you're unaware, is kind of the diagnostic book or the holy grail that we use or that practitioners use to help diagnose and treat mental disorders. So the DSM-5 criteria for major depressive disorder is having 5 or more of the following symptoms that have been present during the same 2-week period and represents a change from previous functioning. At least one of the symptoms is either a depressed mood or loss of interest in blood pressure. So these patients can have a depressed mood most days or nearly every day, a markedly diminished interest or pleasure in all or almost all activities, significant weight loss when not dieting, insomnia or hyperinsomnia, psychomotor agitation, fatigue or loss of energy nearly every day, feeling of worthlessness, diminished ability to think or concentrate, and recurrent negative thoughts. So these symptoms cause clinically significant distress, and that's another important part of this criteria for diagnosing a patient with major depressive disorder, is meeting those criteria and the time frame, right? This needs to be going on for longer than 2 weeks. For a lot of people, it's normal to have some down days, so this prolonged period of depressed mood is something we need to look out for our patients or our clients. Now, there are some screening tools out there that can be beneficial to kind of help us catch major depressive disorder. One in particular is the PHQ-9 depression questionnaire, which can help us quantify how severe a patient's depressive disorder is. Now, when we've established or have the thought this patient might have major depressive disorder, what can we start doing? What are some treatment options that we have that we can use to help these patients? So some things that we can use, we can start with lifestyle modifications, and therapy is always a good place to start if a patient is open for it. And a very important, concept that we want to remember is working with our patient to find the best treatment plan that we can make, right? The best treatment plan is one that the patient is going to be able to do. So some lifestyle modifications that we can look at is a better sleep schedule, really trying to focus on getting continuous healthy sleep for, goal 8 hours or more. We also can, exercise. Exercise is phenomenal, and it's actually been proven to be just as helpful as taking medications. So even just helping the patient take stepwise approach, just trying to get out there 10 minutes or just anything above baseline and continue to build on that progress is going to be beneficial. There's also cognitive behavioral therapy. A patient can work with a specialist to help change their thought process and how they view the world and view the situations, and really try to help them, understand their symptoms and what they can do in a cognitive behavioral standpoint. Another piece of the management that we can use is medications. And now our first 2 big first-line medications that are very common to be used are selective serotonin reuptake inhibitors, better known as SSRIs, or serotonin and norepinephrine reuptake inhibitors. And what these 2 drugs do, the SSRIs will keep serotonin in the synaptic cleft of the neuron for a little bit longer, while SNRIs works on both serotonin and norepinephrine. Now, it's important to let your clients or patients know that these medications can take up to 4 to 6 weeks to really see their full effects. These medications also have side effects that we want the patient to be aware about: nausea, headache, fatigue, dizziness. These are just some small ones, but the main black box warning, so this is something very important you want your patients to be aware of, is that there's a black box warning for increased suicidal ideation. in particular young adults between 18 and 24, and this is something we want them to be aware of and to keep an eye on. If they start experiencing any symptoms in regards to suicidal ideations, that they want to let their provider know, and they can come up with a plan to see what they can do. Maybe it's changing the medications, or there's other routes that they can go. So this is very important, and this is kind of just discussing major depressive disorder and getting a small understanding of a very complex mental illness. Thank you.